This lesson is Chapter 8, Preparing Large Volume Parenteral Preparations. Learning objectives are to gain awareness of the historical roots of large volume parenteral preparations, understand the physiology of fluid balance and chemical properties of parenteral products, identify the risks associated with parenteral administration, describe the components and critical sites of various large volume parenteral preparation supply items, identify USP Chapter 797 procedures that must be performed prior to compounding large volume parenteral preparations, and demonstrate correct aseptic technique in preparing large volume parenteral products. We will be doing the last learning objective as a process validation step in the laboratory component of this course. As an introduction, in the hospital setting, IV technicians are primarily the parties responsible for preparing parenteral solutions for patient administration. These medications are administered by any route other than the alimentary canal, generally being by an injection. So part of the component of administration of a parenteral product is to maintain the correct fluid status for the patient whose condition disrupts their body's innate fluid balance. The physiology of fluid balance. Water is a critical element of the human body, making up approximately 70% of the human body's weight. Primarily, it's found within the cells of the body or the intracellular space, but it can also be in space between cells, which is known as interstitial space, and also in spaces outside of cells, which is known as extracellular spaces. Also, it's a component of blood vessels, where it's found in the intravesicular space. A good portion of our blood is comprised of water. Maintaining the proper level of fluid and electrolyte within the body is known as homeostasis. And as you've learned in 109 and we've talked about in 104, homeostasis is essential for human life. The fluid enters the body through the normal processes of drinking and eating and will exit the body through perspiration, respiration, urination, and bowel evacuation. So fluid balance, generally we want to replace fluid daily. So what we put in will be approximately equal to what we put out. So we should intake about 2 liters a day, basically, and we expect to put out about 2 liters a day. When certain conditions affect normal fluid intake and output, patients may be at risk for dehydration. So dehydration occurs when the amount of water entering the body is less than the amount of water leaving the body, when there's an extreme loss of fluid, which may lead to kidney failure, cardiac arrest, or even death. So that's very important. We have to keep those pumps functioning properly. So if there's not enough fluid to keep them functioning properly, they will shut down. The quickest method of rehydration is through injection of parenteral solutions into the blood supply. The vast majority of compounded sterile preparations prepared by the IV technician are large volume parenteral products. Next, we're going to discuss properties of parenteral products. Because these are administered directly into the blood supply, it's important that they have certain characteristics, especially chemical properties or characteristics, to make sure that they're safe for our patients. Some of them include the pH value, osmolarity, osmolality, and tonicity, as well as the compatibility of the additives themselves. So for the pH value, as we know, the blood is slightly alkalinic with a pH of approximately 7.4. The degree of alkalinity or acidity of a solution is referred to as its pH value. and it's measured on a 0 to 14 scale. Any solution with a pH of less than 7 is considered to be acidic, where any solution with a pH greater than 7 is considered to be alkaline. If it has a pH of 7, it's considered to be neutral. Like I said, human blood has a pH of approximately 7.4, which is slightly alkaline. The pH of blood plasma must be maintained for optimal health. In some facilities, a buffer solution is used, such as sodium bicarbonate. It's injected into the compounded sterile product to neutralize the pH and prevent patient discomfort. If the solution itself is too alkaline or too acidic, it will burn on administration. Continuing with properties of parenteral products, next we're going to talk about osmolarity and osmolality. So these terms, although similar, do have some specific differences. Osmolarity is the measure of the number of milliosmoles of solute. So that's the kind of drug part, that's the measurable part of the solution, and the units are capital O, SM per liter. So milliosmoles per liter of solution. Osmolarity refers to the osmotic pressure that's applied by a solution across the cell wall. The osmotic pressure is the pressure required to maintain equilibrium within the cells. Osmolality is the measure of the number of milliosmoles per solute per kilogram of solvent. So osmolarity is measured with liters of solution, where osmolality is the solute per kilogram of solvent. It refers to the number of ions, or the molecules themselves within the solution. So these osmolarity and osmolality will affect the flow of fluid into and out of the cells in the body. To maintain optimal health, of course, we want to maintain homeostasis, or a state of equilibrium. Compounded sterile products have to be what we call isoosmotic. So we don't want to have too much pressure, or hyperosmotic, or not enough, which is hypoosmotic. So that state of equilibrium, like I said, is isoosmotic. That means that the solution is relatively the same number of dissolved particles and the same osmotic pressure as our blood plasma. And that's important for healthy blood cells. That leads to the quality of tonicity. So tonicity refers to the way the cells or the tissue responds to the surrounding fluid. So in this diagram, it's giving you the effect of tonicity on the cells in a solution. So if the body cells are in an isotonic solution without a net change between the intracellular and extracellular concentration, things are going to move according to a concentration gradient osmosis. So where there's more particles, more fluid's going to go. So the direction of the movement of the water is going to be from the area that has less particles to the area with more particles. In human cells, as long as we have an isotonic solution, we're going to have a free flow of fluid into and out of the cell, and it's not going to disrupt the cell itself. When we have a hypertonic solution, we're going to have a lot more solute or particles outside of the cell, so that means that more fluid is going to be coming out of the cell than what will flow back in through osmosis. So when that fluid flows out, it shrinks the cell and can damage it. It shrivels it up. If we have more particulates inside, if we use a hypotonic solution, the fluid from the solution is going to want to flow into the cell where there's more particles, and only a little bit's going to come back out. It's kind of like filling up a water balloon. So as we put more fluid into that cell, eventually that cell membrane is going to reach its maximum capacity and it's going to break open. And that's going to cause death of the cell. So a hypertonic solution contains a greater number of dissolved particles than the human blood plasma. So the fluid's going to flow out from the cell into the solution. A hypotonic solution has fewer dissolved particles. So the fluid from the solution wants to flow into the cell, and that's where it's going to expand and burst. An isotonic solution contains a number of dissolved particles equivalent, so it keeps the water flowing back and forth with an equilibrium. Now we're going to take a minute to watch a video on tonicity.
Welcome aboard the BioTrain. In this video, we're going to talk about osmosis, which is the diffusion of water across a membrane. This is important for a living cell because it's a big part of maintaining homeostasis. It's also important because a cell membrane can't stop water from diffusing into or out of the cell. This means that the environment that the cell is in determines whether water will diffuse into a cell, out of the cell, or there won't be any diffusion at all. So the three different types of environments are an isotonic solution, a hypotonic solution, and a hypertonic solution. So let's go through all three and see what's happening. So the first one is an isotonic solution. This is where you have equal concentrations of water on the inside and the outside of the cell. So there's no net movement of water. The same amount of water is being bumped out of the cell as is being bumped into the cell. So the cell can maintain its water balance. The second type of solution is a hypotonic solution. The reason I said hypotonic is because there's a higher concentration of water outside the cell than inside the cell. More water is being bumped into the cell than is being bumped out of the cell, so water will diffuse into the cell, causing it to blow up. So it's hypotonic. The last type of environment is a hypertonic solution. Hypertonic. I'm getting smaller, hypertonic, because there's a low concentration of water outside and a high concentration of water inside. This means that water will diffuse out of the cell, causing the cytoplasm to shrink. Once you understand these three environments, you'll understand diffusion in cells. If it's an isotonic solution, there's no concentration gradient and no net movement of water. A hypotonic solution, water will diffuse into the cell, causing the cell to expand, and a hypertonic solution, water will diffuse out of the cell, causing the cell to shrink. I hope that was helpful.
So some conditions that require treatment with parenteral solution that is either hypertonic or hypotonic, we need to be aware. Total parenteral nutrition, or TPNs, and other hypertonic solutions are generally administered into a large vein, such as the subclavian vein or the superior vena cava. These larger veins have a lot more blood flow, so they're better able to accommodate the hypertonic solution and dilute it just a little bit quicker. Unlike hypertonic solutions, hypotonic solutions are rarely given to patients. Occasionally, critical care patients who are experiencing diuresis or excessive fluid loss are treated with these solutions to replace the high volume of fluid output without significantly increasing the plasma sodium concentration. These patients must be monitored closely to ensure that they do not develop a potentially life-threatening electrolyte imbalance known as hyponatremia.